My mother died of lung cancer. Her mother died of lung cancer. She really struggled to breathe in the end, and it was really difficult for me to watch. I truly felt that was the future for me until I learned differently. My name is Marty Henley. I'm a retired certified registered nurse anesthetist, and I have a husband and 3 children who are the world to me. I was diagnosed with lung cancer in 2020. Having been through that experience before, it broke my heart to tell my father.
You cried.
You cried.
And I cried.
It was too difficult. Charleston's a wonderful place to be. It's just a beautiful mountain town, but there are certain challenges that come with that. I felt very uncertain being here, not having a specialty oncologist. I would say the nearest one would be about 3 hours away.
Why should a zip code determine life expectancy? Most cancer patients do not have the best access to care either because of race, location, or socioeconomic status. If we had equal access to care at all the level in cancer patients, we probably would be saving 34% more patients.
The diagnosis is frightening, but when I saw my oncologist, he recommended a test, which really did change the trajectory of my care.
Liquid biopsy is just an amazing technology where we're able to get insights into a particular patient's cancer by just drawing a blood sample. Tissue-based biopsies and liquid-based biopsies are complementary. Sometimes trying to do an invasive tissue-based biopsy is not worth the risk versus just doing a blood draw. You can do that in your local doctor's office. You can do that in your local hospital system. You can do that around the corner in the thousands of patient service centers that Labcorp has around the country. Being able to get these treatments offered locally, especially these innovative treatments that are often only found in clinical trials, reduce disparities in cancer care.
In liquid biopsy, you can even have a mobile phlebotomist that can go to patient's house and collect the blood.
I was able to get my liquid biopsy at my local cancer center, and when I got the report back, it was very detailed. It determined what targeted therapy I could take for my lung cancer. I was able to take a pill versus having chemo and having drugs actually destroy my body. This allows me to take a targeted medication that works against the mutation that was uncovered in the liquid biopsy.
We've already started seeing the impact on my patient population, more patients receiving targeted therapies. We've seen more patients getting appropriate intervention with less toxicity, and we are improving the access to care.
Precision medicine is looking at what is driving cancer, and so that could be a lot of patients. Personalized medicine is for that individual patient, what is actually driving their cancer and what's the best way to treat that individual patient.
My treatment plan has allowed me to enjoy those things that are really important in my life, and the things that matter the most to me are family, being there to care for my father, and planning my daughter's wedding. I never thought there would be hope, but there is hope.
Cancer doesn't care where you live, how rich you are, or what race you are, and neither should we. We have amazing tools today, but if we don't increase access to these diagnostic tools and these therapies, our job is incomplete. And so that innovative process, that innovative mindset is critical for us to ultimately, hopefully, cure every single cancer patient. But in a worst case scenario, make cancer a chronic illness. It's a never-ending pursuit. We're always looking for answers.